evening. We are doing principles of pharmacology tonight, and this is actually pretty fast paced. So there's a lot that goes into the principles of pharmacology. Understanding the building blocks of pharmacology is paramount to anyone is an EMT, or if you're going further and you're going to become a paramedic, or you're going to become or an intermediate or a paramedic. So we're going to talk about safety and all the different kinds of meds that you may use and how to help administer those. You're also going to learn about the names, effects, actions, indications, and contraindications, along with complications, routes of admin, side effects, interactions, and dosages. And the further you get into pharmacology, the further and more extensive the knowledge is going to be for each thing that you do. When I went through paramedic school many, many years ago, we had to do drug cards from scratch. They had to be handwritten, and I still have them. And I had about 80. And we had to learn what it did down to the cellular level. And I'm so thankful that I had that years ago, because now as a nurse, it's easier for me to talk to my patients. And as a paramedic, it was easier for me to talk to my patients and even more so understand what's really going on with their bodies. So medications are an important intervention. And I'm going to ask you guys, and I want you to drop this in the chat for me. How many of you know one of the most used and given medications that we give on the ambulance? Just drop it in the chat. Right, wrong, or indifferent, just drop something in the chat. What do you think is the most used medication on the ambulance? So medications may alleviate pain. They may improve the patient's condition. And I mean, obviously, that's what we want to do. But even failure to administer meds in a safe way and even competently. Now, understand the word competently means that you use it in the right way on the right patient at the right time with the right dosage. And you have those 5 rights of medication, and then you give it at the right time, and you continue doing that until they improve. Otherwise, there can be consequences up to and including death. And I have only 2 people. There are 14 of y'all, so I expect a lot more to enter into the chat box what y'all think this is. And I'm just gonna see what. Well, Debbie, you already said oxygen. I'm gonna leave it at your first one. Anybody else want to take a guess? Sydney, you have your hand up. Can you just put it in the chat box for me?
I had my hand up because for some reason the 2 slides that you just showed are not in my PowerPoint slides that I have. That's all.
Okay, that's odd. I downloaded this from the SharePoint myself, so I'm not sure what happened there.
Yeah, I printed mine out today and I downloaded it from SharePoint. And the first page it says chapter 12 principles of pharmacology. And the first slide that I have is pharmacology, and it says applies fundamental knowledge of the medications that the EMT may assist or administer to a patient. And
yeah, we're on slide 8.
I'm gonna say because I did not.
I go through the introductions very quickly.
Oh, I looked at. Okay, I'm sorry.
No, you're fine. You're absolutely fine. You're not the first person to make that mistake. I did that once when I was in EMT school too, so you're totally fine. I promise. I would rather you do that here than anywhere. So,
Oh yeah, I was
okay,
so concerned. I was like, where'd it go?
right? Like, wait. No, I did what I was supposed to do. I get it. You're fine. I promise. You're so welcome. Okay, so I'm gonna go ahead and tell you guys. I'm glad that some of y'all are answering. Thank y'all so much. Oxygen. Oxygen is the #1 used medication on the truck. I see here, okay, Narcan's not really used a whole lot, as a matter of fact. NSAIDs, depending on what agency you work for, you may not even have NSAIDs on the truck. Oral glucose, I would say oral glucose and D50 are probably a safe bet for a second, unless you want to use IV. Because that is a medication, it is a solution. So I would say, between uh, IV and your and D50 is sugar. So maybe so in your area, Debbie, but it's not nationwide. Um, but oxygen is definitely number one, and but you can look those up online for your area or for the nation, as a matter of fact. But pharmacology defined is the science of drugs. And a medication is a substance that's used to prevent or treat a disease or even relieve pain. So, pharmacodynamics is a process by which medications work on the body. Remember, I said I'm really appreciative of the fact that I know things down to the cellular level. This is what pharmacodynamics is really all about. It talks about how, and I'm not going to get this far into it with you guys, but I will say that pharmacodynamics talks about getting down to that cellular level. It talked about receptor sites, and even Narcan, for instance, it gets on certain nicotinic N receptors, and it pushes opioids off out of the way, and on opiate receptors. So there's a whole lot that's involved with pharmacodynamics. And like I said, I'm not going to go crazy into those. So an agonist, if you're going to agonize someone, you're going to stimulate it. Think about it. If I'm agonizing you, if I'm agging you on, that's going to stimulate. So remember that. We keep it, KISS method, keep it simply smart, right? Simply sweet. If it's an antagonist, that binds to the receptor and blocks other medications or chemicals. So, a dose is just an amount of medication that is given, and an action is the therapeutic effect that a medication is expected to have on the body. So, when I give someone oxygen, I expect them, especially if it's a therapeutic range, even, I'm going to throw that on there, it's going to give a therapeutic effect to the patient. It's going to cause them to have a better outcome, and they are going to start trending in better, right? But there's a lot of and let me back up to dose. I want to talk about how the amount of medication given is dependent on a lot of things. The first thing is patient's weight, their age, their desired action of that medication, even. And so these are things that we have to look into. Okay, so pharmacokinetics is the actions of the body upon the medication or chemical. So, what is their onset of action? What does that mean? It's time from medication administration until the clinical effect does occur. So, when we're talking about that, when you get, if you have an IV and you get, let's say Benadryl, because Benadryl is something that a lot of people know. Um, and it does cause an effect on the brain. You will be at one point where you may get a little loopy if you take some Benadryl, right? So the onset of action when you give somebody Benadryl through, which you guys are EMTs, you wouldn't do this, but the onset of action through an IV is within like a minute to 2 minutes. It's pretty quick. But if you take a pill, if you take a tablet, that onset of action takes a little bit longer because it has to go into the mouth, it has to go into the stomach, it has to be absorbed. So it all depends on how it's given. But the onset of action, you have your duration. How long is that going to last? Elimination. How is this going to be removed from the body? Is it going to be through the kidneys? Is it going to be through other means? And then there's another one. What's the peak? What is the peak, the point or the period when the maximum clinical effect is achieved? So what does that mean? Okay, put it in the chat box for me, guys. Does anyone here know why we have to take 7 days worth of antibiotics? And just go ahead and put it in the chat box for me, okay? And I know that's going to take a second. If you know, you know. If you don't know, say, I don't know. It's fine. Or IDK. I take those too. And because I would love to tell you. And I'm going to give y'all just a minute to go ahead and say that, type that in. Michael with the answer. Okay. Um, okay. Miss Givens has it right. 100. I mean, Michael does too. Debbie, good. Lewis, totally fine. Okay, and a lot of people in this class probably don't know this. So when you begin a set of antibiotics, you have to take X amount during certain periods. So if it's 3 times a day or if it's twice a day or whatever it is, and you want to take it for all of this time period because it's going to hit a peak and then we're going to stay at that peak until you stop taking it. So after you stop taking an antibiotic and it's over with, you're still getting the effects of the antibiotic for a few days after. So that's why. And that the bacterial growth is exactly what it's talking about, what Michael and Debbie were explaining in there. So that's very good, guys. Very, very good. Okay, so factors affecting how a medication work is the route of admin and shock states. So if they have lost a lot of fluid or something like that, it's going to work differently. An indication, it's indicated to use it for this. Okay, if it's a contraindication, it means you're not supposed to be using this. It's going to cause a harmful effect. And one of them is absolute and the other one is relative. And we'll talk about, just so you know what absolute means, is that this should never be given, ever, at any point in time. And you're going to see a lot of contraindications, of absolute contraindications dealing with pregnant females. And because we know that it causes harm to the fetus. And then you have your relative contraindications. It's like, well, administering this drug, it's going to outweigh those risks. The benefit outweighs the risk here. And then you have adverse effects. Guys, unintended effects are the ones that are undesirable, but they're really little risk to the patient. So an unintended effect is like giving someone, it's also a side effect, so I want you to understand this. But if you give somebody morphine and they become nauseated, it is because morphine makes a person nauseated. Okay? It's just how it works. 90% of the patients that receive that medication also are nauseated. It's unintended. It is also a side effect, but it poses a little risk to the patient. But an untoward effect, that can be harmful. Okay, so medication names, you have your generic, that's ibuprofen. Okay. Which I hate that they did this because the generic for Tylenol is actually acetaminophen. But there is this. The trade name is the manufacturer's name. Okay, this is there's one drug may have more than one trade name. So example, Tylenol, and you will see. I know that there's other names for acetaminophen out there, or acetaminophen added into other things, but Tylenol. That's one. Everybody's like, oh, I'm gonna go take some Tylenol. Well, it's really acetaminophen is the generic. Okay. And then you have your prescriptions. You have your OTC. You're going to hear me say OTC a lot. So you know that that's over the counter recreational drugs. You've got your heroin, your cocaine, name it, right? Herbal remedies, also another one, just name it. There's so many of them out there. Enhancement drugs. And enhancement drugs can mean 2 different ways. It can mean muscular or it can mean erectile dysfunction even. You have vitamin supplements, you have alternative medications. There's a lot of those out there. So any of these can cause an effect. So you really need to be thorough when you're asking like, hey, all of your medications. Oh, okay. People will, unless they're a heart patient and they know they're supposed to say that they take aspirin daily, they may leave that off. Or it may be somebody who has been suffering from a headache for days on end, and they've taken 40 Tylenol. That's important. That's very important. So let's talk about routes of administration. You have enteral medication enter the body through the digestive system. Um, and then you have parenteral, which is medications enter the body by some other means. So usually when we say enteral, it means that it's like a pill, it's a liquid. Think about, Tylenol, for instance, and Tylenol can be in pill form or in liquid form, depending on how old the patient is. So medications that are administered this way tend to be a lot slower because of the absorption rate. But whereas parenteral is by another means, right? So that's going to be more like your needles, syringes, and they're absorbed a lot quicker. And they're definitely more predictable, and there's more of a measurable response when we're using those. Absorption is the process by which medications travel through body tissues to the bloodstream. So let's think about some of our common routes. We have PR, which is per rectum, or we have PO, which is per os or oral. So that's going to be by mouth. I don't know where. I think per os is Latin. I'm almost positive it's Latin, and that's where it comes from. But just know that when you have an oral medication, a PO med, okay, that takes about an hour and sometimes even longer to occur. I was told that people should also take a medication called Align to help with good bacteria. I have no idea about that. I would talk to your doctor about taking any other medications to help with bacteria in your body. But good question. Okay, so let's talk about IV. This means into the vein. That one's pretty easy. IO, into the bone. Sub-Q or subcutaneous. It's actually SC, but you will see people put sub SUBQ. That is the incorrect abbreviation. You should say SC, and that's beneath the skin. And then you have intramuscular or an IM, and that's into the muscle. And in the fastest one is obviously into the vein, which is IV, whereas our slowest route is going to be PO. And into the bone, it goes through our blood marrow, or I mean, not blood marrow, Jesus. Sorry, guys, bone marrow. And then it reaches the bloodstream through that, but you have to have a needle and all sorts of stuff. Sub-Q or subcutaneous, that's just the injection is in the fatty tissue, and that's between the skin and the muscle, whereas intramuscular is obviously into the muscle, and it's usually absorbed quicker than your subcutaneous ones. And then you have your inhaled, and those are the ones that are breathed into your lungs. That's going to be something that's going to be like an aerosol. Some of them are fine powders. Some of them are sprays. You have sublingual, that's under the tongue. And then you have transcutaneous, which is transdermal through the skin. So that one's going to be the one that's going to be on top. It's like a patch. Okay. And we have fentanyl patches, for instance, morphine patches, hormone patches, and they have more of a longer lasting effect than the other routes. Yes, that's correct. It's a pain patch. It can be, or a hormone patch or something like that. It can also be over the counter nicotine patches. Relatively new formats are the intranasal ones, okay? And this is into the nostril via a mucosal atomizer device, or a MAD. You'll see it called, it'll be all caps MAD. And this is super quick absorption, and you'll see Narcan is one of those now, and has been for a minute. Table 12-1, go ahead and know that and see these are rapid, intermediate, and slow. And let's talk about medication forms. The form of medication usually dictates the route of administration. So the manufacturer is going to choose that form because they know that this is going to be the proper route of administration. They know the timing of the medication's release into your bloodstream because they've done all the research on it, and the effects on the target organ or body systems. So let's talk about tablets and capsules. The capsules are gelatin shells filled with powder or liquid medication. And your tablets, they are going to contain other mixtures or other materials that are mixed with the medication, and then they're compressed. And those usually help with absorption in tablets, okay? Solutions and suspensions. A solution is a liquid mixture of a substance. Okay. One thing about that is it will not separate by filtering or even letting it stand. So this can be given IV, IM, subcutaneous injection. Okay, that's in the vein, intramuscular, or subcutaneous. But a suspension is a liquid. Well, Okay, a suspension is a substance that does not dissolve well in liquids. So it will separate if it stands or it is filtered. The one that a lot of people will think about when they're thinking about a suspension is going to be activated charcoal. That's definitely the biggest one. Um, MDI is a meter dose inhaler, and you'll see people call it MDI a lot, so get ready for that one. These are liquids or solids that are broken into small enough droplets or particles that may be inhaled, and this directs such substances through the mouth to the lungs, and it literally gives the same amount each time it's used. And it's often used for your respiratory illnesses such as asthma or even emphysema. And there's a skill drill probably coming up in just a minute about how to use these inhalers, but it's very important. And I want you guys to realize that before you use an MDI, especially if you're helping a patient with their MDI during an asthma attack or their emphysema or whatever, you want to make sure and open up the bottom, shake well, and then just spray in maybe a 4x4 or something, and get that first one out of the way, because sometimes if they go a while without using their inhaler, it won't be loaded correctly with the correct dose of medication. And when we're only allowed to give them 2 puffs from their inhaler, we want it to be loaded correctly. And then we'll later on it'll be discussed on how to continue on with that. Topical medications, those are lotions, creams, and ointments, and those are just applied to that skin surface and only in that affected area. We don't want to go all over the body, but lotion is like your calamine lotion, and hydrocortisone cream, and your ointment is like Neosporin. Okay, so transcutaneous meds, they're designed to be absorbed through the skin, transdermal, also called transdermal. They may have systemic effects, like your hormone patches, or even your pain medications. Now, here's the bad part about a transcutaneous medication or a transdermal. And even if I can, I'm going to back up real quick and talk about topical medications too. If you give this without it being on a gloved hand, guess who also gets that medication? Same thing here. If you touch a medication with your skin, you are going to absorb it, just like the patient. Okay. When we are dealing with sublingual medications, that's another thing. We don't want to degrade those medications by putting it in the palm of our hand and then putting it back into the pill bottle. And also and I'm thinking specifically nitroglycerin, that's one. If you help your patient with a nitroglycerin tab, same thing can happen. So you don't want to absorb any of those. So when you were dealing with a patient, remember, we always go in with our gloves on at the very least. At the very least, we have our gloves on. So gels, these are a semi-liquid. They're administered in capsules or through your plastic tubes. And as you can see, you have your little glucose down here. So that's something that you have on the truck all the time. Gases for inhalation, usually through a non-rebreather or a nasal cannula, and of course, oxygen. We've already discussed that one. So let's talk about general steps in administering a med. So medication should be administered only under the authorization of med control. Okay. You're going to follow the rights of medication administration, and you will need to know these rights, period. So we're going to go through those real quick. And I think it's on like the next slide, maybe. I'm not real sure. It seems like it's a slide somewhere, or it's like a table somewhere in your book, but you have to have the right patient. Okay. You got to make sure you're giving it to the right person, right? Okay. It's got to be the right medication and indication. So we got to verify that it's the proper medication and the proper prescription. What is the right dose? We have to verify the form and the dose of the medication. So right dose could mean 1 tablet equals this amount of dose, okay? Right route, verify that you're giving this correctly. It's going in the right way. Um, right time, we're going to check for the expiration date and the condition of the medication. If you have something that is in liquid form and you see particulates floating in it, that's not good. That's bad. Right education is the sixth one. This is the newest one that they've just added on not long ago. And this one is informing the patient of what you intend to administer, and you're going to tell them all the adverse effects or even unusual sensations that they may experience. Why? Because we tell our patients everything that we do before we do it. We don't want them to be surprised at all. And then another newer one is a right to refuse. The patient that has that decision making capability can refuse or decline literally anything. So this is definitely one of them. And then right response and evaluation. We're going to monitor their signs and symptoms, their perfusion rate, respiratory effort. We're going to check and see that, hey, we have an anticipated response, but if there's any adverse medication reaction or effects, I need to know about those immediately. Right documentation. Now we have to document our actions and the patient's response to that. So medication errors almost always result from failure to follow these rights. That is 100% true. Um, in uh, in the middle of a cardiac arrest, there have been people that have given the wrong drug because they said, "Hey, hand me the epinephrine," and someone hands them another drug that is in similar properties, similar. I can't even say that they're similar colors because they're not, but um, similar packaging, and the patient gets something completely unuseful. So that's one way that happens. There's a lot of other ways too. I'm just throwing in one. So, okay, it is in here. It's table 12-3. Absolutely 100% know these. You will be tested on them from this point forward. You will see them on the quiz, the module exam, and the final. And you'll see them on national registry. So definitely know those. Okay, so let's get through this slide and then we'll take a break. So circumstances in which medications may be administered. So you have peer-assisted administration, and that's where you literally will help medicate yourself or your partner. All right. An example of that is, hey, what if you had some sort of toxic agent put on you? Okay, well, now we know we need to do some stuff, right? Then you have patient-assisted administration, and that's where you're going to assist the patient with their own medication, not ours, theirs, okay? And think about this like an auto-injector, nitro, that MDI, okay? And nitro is short for nitroglycerin. And so you even have EMT administered medications. And those are the ones that are like oxygen, oral glucose, aspirin. And the patient can be severely confused or unable to understand the need for these medications. So we have to help them understand, right? Um, so these are determined by state and local protocols. So your med control, state guidelines, local protocols, that all determines what you can do in your system. So always go back to your protocols to find out what you can administer and what you cannot. Okay, so it is 6:59 and we are going to go ahead and take that 10-minute break now. And when we get back, we will finish up. All right, be back in a few. Okay, guys, so let's go ahead and go over oral medications, okay? Confirm that the patient has a patent airway. They're able to swallow. They can follow commands. And then as you find these out, go ahead and take your standard precautions. Confirm that your medication is not expired. Go ahead and obtain your medical direction per local protocol. So make sure you have an order for it, right? Because we don't want to go above and beyond and go outside of our scope of practice, because that's bad. Confirm that the patient has a patent airway, able to swallow, chew the medication, whatever it is, and then give them the medication, ask them to swallow or chew it, and then monitor, then document. Super simple, right? Sounds super simple. Oral glucose, that it's kind of self-explanatory, but for those of you who don't know, glucose is sugar. It's all it is. And what that is it goes into the cells and it's used for energy. And it's definite, like, remember when I told you guys, you have two different things that you need to, your brain needs to survive. Can you put it in the chat box for me what those two things are? And I'm going to continue going. Obviously, glucose is one of them. What's the other one? So what does it do? It treats hypoglycemia. Hypo meaning below. Um, hyper is above. So hypoglycemia is going to be low blood sugar, and nobody wants that. So, and the correct answer is oxygen. It is glucose and oxygen. That's what it needs to survive. Without either one of them, the brain will no longer function. ENTs can give this only by mouth. Okay, oral glucose doesn't go on your skin. It does not go per rectum. It does not go in an IV or IM or subcutaneous or transdermal or any other way. It is only given to them by mouth. Okay. And it's in the form of a gel. And never administer oral medications to an unconscious patient or to one who is unable to swallow or protect their airway. Okay, why do you think that is? And I'm going to go ahead and answer it because I want to move on. But obviously, if they can't protect their airway, they cannot swallow, they cannot follow commands, or they are unconscious, they are going to aspirate. Very good, Debbie. They will aspirate. And if you get a gel into the lungs, that's really detrimental. Pardon me, aspirin is another one. Now, aspirin does a lot of things. It reduces fever, it reduces pain, it reduces inflammation, and it inhibits platelet aggregation as a COX-1 inhibitor. Now, you didn't even know that last part, but some of y'all are going to go look that up. And it's useful during heart attacks. Okay, if it inhibits platelet aggregation, that sounds like a lot. So let me go ahead and tell you. Inhibits means it stops. Platelets, when they bound together, they cause a clot. And aggregation means to gather around. So if it stops platelets from being sticky, because that's essentially what it does, then that means that the clot that's already there isn't going to get any bigger. So we are going to go ahead and give them an aspirin if we think that that's something that they need. So there are some contraindications, hypersensitivity to aspirin, and that's like, and when I say hypersensitivity, I'm talking about they have a bleeding disorder. They have liver damage or a pre-existing liver damage. They have asthma. These are times when we don't want to give that, okay? Do not give this to children ever, okay? Just don't. They can't handle it. They can't metabolize it. It can hurt them. So sublingual medications, there's a whole bunch of advantages. There's a few disadvantages. So advantages is, well, it's easy to advise patients. Hey, put this under your tongue until it dissolves. Don't swallow it. Don't chew it. That's it. Simple. Put it under your tongue. And it quickly absorbs. Even the longest sublingual pill that it takes to absorb is only maybe 1 to 2 minutes. And that's only if their palate is very dry, because the mucosal layer, the more hydrated a person is, the more salivation that there is in the mouth. So when you put something in their mouth and under their tongue, they are going to salivate. And so That's how it has a quicker absorption. It's going straight into the mucosal layer. It's really nice, okay? But there's some disadvantages, okay? So we have to constantly evaluate that airway, right? They could possibly choke on it, even something very small, and not for uncooperative or unconscious patients. So let's look at nitroglycerin or nitro. That relieves the angina pain or cardiac chest pain in cardiac patients. And what it does is it essentially just increases blood flow by relieving the spasms and causes arteries to dilate by relaxing muscles of the coronary arteries and veins. So essentially what nitroglycerin does, the long and the short of it, is that you have these tiny little muscles that are all over your veins throughout your body. And nitroglycerin just kind of says, hey, relax. And when it relaxes those muscles, they'll just relax, and then the arteries will dilate a little bit further open. Or the veins will also, the veins actually do more than the arteries do, the coronary arteries, but it does work on the coronary arteries as well. And so that's just how it works. It's pretty nice. It decreases the workload of the heart. It and that helps somebody when they're in the middle of a heart attack. So here's some hard and fast rules that absolutely must apply when you are giving nitroglycerin. Know them, love them, eat this for breakfast, guys, because it's going to be on a test. You're going to see this again. Before you give any of this, especially nitroglycerin, we're going to check their blood pressure. And then you're going to obtain an order. Now, you can have potentially fatal interactions. So we need to obviously find out what they have used prior to. If they have used any erectile dysfunction medications or ED medications taken within the past 24 hours, that's like your Viagra, your Cialis, Levitra, then you need to say no. By the way, erectile dysfunction medications can be used by both men and women. And if you don't know why this is such a big deal, let me give you the history of how erectile dysfunction medications came to be. They came, exactly, it drops your blood pressure because it was originally designed as a blood pressure medication with a very, very interesting side effect. And the people that did all the research said, hey, we have an idea. Let's not market this as a blood pressure medication. Let's market this as the side effect, which was it took care of erectile dysfunctions. They started redoing the testing and using men that had erectile dysfunction, and this flying off the shelves still, okay? So this is why, if you did not know that Viagra was the very first one, and it was originally designed as a blood pressure medication. So we're giving nitroglycerin that's going to drop your blood pressure to somebody who's taken Viagra, which was originally designed as a blood pressure medication. Now, what do you think is going to happen? Well, you've just doubled up blood pressure medication, so to speak. You're going to drop their blood pressure, and it can kill them. So hey, yeah, it's really some days when you're talking to patients, it can be a little cringe. It can be a little awkward and everything else, but I'd rather be awkward than be, doing CPR on somebody because I gave them the wrong medication and I didn't ask the right questions, okay? Now, another thing is it's going to cause a mild headache. And the reason for it is, let's go back to what it does. It dilates blood vessels. Well, it's not just blood vessels like in your hands or your feet. It's all over the body, including in the head. And remember, if we have any excess amount of space taken up in a head, such as, dilating all the blood vessels, it's going to cause some pain because there's not a whole lot of room up there, right? So it makes sense. Now, we're going to administer. So if we're doing tablets, we're just going to put one simply under the tongue. There is going to be a slight tingling sensation. Never say burn, because people say, if you say, hey, it's going to burn a little bit, most people go straight to thermal burn images in their head. Okay, so let's alleviate some of the potential risks here to their psyche and their emotional state, and say tingling instead. Okay, storage is very important. They have to be put into a dark dark container. It cannot be, it has to be in a glass container with a screw cap, and it has to stay tight, and it has to also be stored away from sunlight. Administered by a meter dose spray, this one's different. It's going to deposit just the medication on or under the tongue, mostly under. One spray equals one tablet. You're going to load this one as well. So you're going to take out a 4x4, and you are going to cover the meter dose spray 1 or 2 times inside, and make sure you have gloves on. Because guess what? If you don't have gloves on, you spray that, guess what happens? Do not be the person that sprays it in the air. Okay, that 20 years ago, that used to happen quite often. And I would walk away from the ambulance with a headache because my partner refused to use a 4x4. So that's one of my pet peeves. If you ever work with me on the ambulance, that's that's the first thing you're going to learn not to do. So let's talk about administration considerations. We're going to wait 5 minutes. Why? Because first off, we need to see what the response is going to be. We don't want to give them too many medication dosages before we see how far their blood pressure may drop. Okay, so you're going to wait 5 minutes. Monitor those vital signs, take that vital sign. You're going to obviously wear your gloves and know your protocols, okay? And you're going to reconfirm if the medication is still even indicated for the patient at this time, okay? Advantages for intramuscular medications, okay? Advantages like quick, easy, without using a vein. And there's a stable blood flow to the muscles, so we know that it's going to work pretty quickly, all right? Unless it's like severe illness or like a severe injury to that area, we pretty much know what's going to happen. Disadvantages, you got to use a needle, and that causes pain, and patients may fear pain or injury. Epinephrine, here's one. This controls the fight or flight response, and the primary medication for delivery is your IM, or intramuscular, also called adrenaline, and it's released inside the body under stress. And it's considered a sympathomimetic. And it increases your heart rate and constricts blood vessels. So if you want to go back over here and see, it says controls fight or flight response. It increases your heart rate and constricts your blood vessels. So what does that mean? It means if you see a dinosaur coming after you, the first thing you're going to do is take a really deep breath. Your eyes are going to get really wide, and you're going to start running away as fast as you can. So your blood pressure is going to go up, your heart rate's going to go up, your respiratory rate's going to go up, your blood pressure, your blood vessels will constrict, and that's what your fight or flight response is, and that's what epi does, okay? Do not give it to patients that already are hypertensive, hypothermic, having a myocardial infarction or heart attack, or they're wheezing. It contraindicated for that. Why? Because of what I just told you it does, okay? And then, let's see, make sure I haven't missed any on the notes. Maybe delivered through the auto injector because of anaphylaxis. So when you're doing that, there is a set way to do it. It automatically delivers like a preset amount, and usually that's 0.3 milligrams. Okay. Narcan or naloxone is going to be used to reverse the effects of an opiate overdose. Some of our important considerations are going to be consult medical direction prior to giving it, and the effects may not last as long as the opioids do, so repeated doses may be necessary, and be ready for those. It can also cause withdrawal symptoms, and it says consider your safety. And one of the reasons that it says consider your safety is because, guys, if you're giving someone Narcan or naloxone, think about what kind of person can potentially be taking this. If it's someone that's using it for a drug high and not an accidental overdose. So you have to think about, are they going to be violent when they come out of this? So always worry about your safety first, and also be advised, like when you're giving this medication, if it's someone that's been taking opioids for a long period of time, it can cause seizures and even cardiac arrest. So be aware of that. Most common technique is going to be the intranasal route. So Um, look for that. Oxygen. So this is our inhaled medications. All cells need oxygen to survive, right? By far the most commonly administered med. We've already talked about that. And it's generally given through our non-rebreather or our nasal cannula. Remember, non-rebreather is up to 15 liters per minute, 10 to 15 liters per minute, where our nasal cannula is 1 to 6. MDIs are nebulizers, meter dose inhalers or nebulizers. That's that liquid turned into Mr. Spray. And it's going to flow with oxygen, and it's delivered to straight to the alveoli. That's where we want it to go. And it has a super fast uh, absorption rate, and it's very easy to get that route, if that makes sense. Like, it's a heck of a lot easier than an IM or something like that. This is probably one of the easier ones besides just oxygen. Maybe sublingual might be a little bit easier. But this is something that's portable. I don't have to carry a whole lot of stuff around. I already have this, okay? Now, the person's having trouble breathing, we may have an issue at that point. Now, this little thing right here in figure 12-11 is called a spacer device. And this helps it's a sleeve that just kind of fits over that inhaler. And there's a mouthpiece on it. The patient is going to spray that prescribed dose into the chamber, and then they breathe it in and out into the mouthpiece because they're going to get all of it. Children, these are who usually have these, they don't have, they're not as easy to go ahead and their capability of understanding what they need to do when they are having trouble breathing is lessened. So they created this where all of that medication is going to be right there in that spacer. And then you have your small volume nebulizers, and they're easier than your MDIs. They do take a little bit longer to deliver the medication, and it definitely requires oxygen source to make this work, or an external air, because you can even have these at home. And it's most effective in patients with moderate to severe respiratory distress. As a matter of fact, when we see somebody that is having these, they're having an asthma attack, we don't even worry about the MDI. We go straight to our nebulizers for the most part. And it can be used with a CPAP or BVM. So let's talk about patient medications here. Patient assessment includes finding out which meds the patient is taking. This is going to tell us really what's going on with our patient's condition. It's going to give us a whole lot of clues, and it's even going to guide our treatment, because that information is going to tell us, oh, okay, well, I know for a fact now that this person, this gentleman took some an erectile dysfunction medication 6 hours ago. And so now I know for a fact I cannot give this gentleman nitroglycerin, right? So that's extremely important to know. And these are going to be useful to know when we go to the ER and we drop these patients off. And sometimes this can help us with underlying conditions, a medical history even. You can literally look at a medication and say, okay, I know that this is a blood pressure medication. I know that this is for someone that has diabetes and stuff like that. Do not underestimate the importance of obtaining a thorough medication history, because, guys, you will find things that are just off the wall in certain instances, and those are the over-the-counter medications that you don't realize are causing such issues. Oh, I'm so sorry, Tammy. I hope you're better, or I hope you get better rather. But there are people that will take over-the-counter medications and not realize that they are counteracting the other medications that they take. So it's very important to find out what they're taking. I will say that there are a lot of people that have medications that they don't take as prescribed. And if you want to think of I would love to say that it's usually kids that don't, or teenagers or what have you, but it's really our elderly that don't take their medications the right way, because a lot of them are on a set budget. And, some months it's either, well, am I going to have heat in my house, or am I going to take my medication? And that's a very sad place to be for our elderly patients. And we don't judge. We help as much as we can, right? So let's talk about medication errors, because there's a lot of those, right? Okay, so it's an inappropriate use of a medication that could lead to a patient's harm, and it may be possible to minimize errors if circumstances are understood. So how do we do that? Sufficient lighting, organize your equipment, limit distractions as much as possible. Consider using a cheat sheet to help yourself remember all the crucial steps to medication administration, okay? These things are so super important. If a medication error does occur, what do we need to do? Well, we need to rapidly provide any appropriate patient care that is required. We need to notify our med control as quickly as possible, follow our local protocols, document thoroughly, accurately, honestly. And you need to go ahead and talk with your partner and your supervisor and then your med control, or your med director, I should say. What does this do for you? It gives you an opportunity to learn, and it also identifies areas to target during quality improvement. Okay, so we are done with this. Now we're going to go over the review. So there are 16 people in this chat. I expect 10 people to answer this question. All right, ready? Pharmacology, number 1. Pharmacology is defined as the A, study of cells and tissues, B, study of drugs and medications, C, effects of medications in the lungs, or D, distribution of drugs to the body's tissues. Number 1, pharmacology is defined as the study of cells and tissues, study of drugs and medications, effects of medications in the lungs, or distribution of drugs to the body tissues. All right, well, I'm getting a whole lot of B's, and B is the correct answer. Very good, guys. Pharmacology is the field of science that deals with the study of medications. And yeah. I got tongue-tied, guys. All right, number 2. Which of the following statements regarding medications is false? A, many medications are known by different names. B, some medications affect more than one body system. C, over-the-counter drugs must be prescribed by a physician. D, EMTs should ask about any herbal remedies or vitamins that the patient may be taking. So number 2, which of the following statements regarding medications is false? A, many medications are known by different names. Some medications affect more than one body system. Over-the-counter drugs must be prescribed by a physician, or EMT should ask about herbal remedies or vitamins that the patient may be taking. You guys are so smart. C is the correct answer. Obviously, it's called over-the-counter because they just hand it to you. You don't have to have a prescription. So very good. Number 3, let me put in here real quick. All right. Number 3, which of the following routes of medication administration has the fastest effect? Oral, IV, sub-Q, or SC, or intramuscular? All right. Which of the following routes of medication administration has the fastest effect? Oral, IV, sub-Q, or intramuscular? Okay. I have a bunch of B's. All right, very good. B is the correct answer. Why? Because it goes directly to into the bloodstream, and when it goes into the bloodstream, it enters the body very quickly, and it goes wherever it needs to go. Okay, so the rationale for oral not being correct is it has to be absorbed through the mucous membranes first to get into the circulatory system. Sub-Q is the medication must pass through the layers of skin before reaching the circulatory system, and intramuscular is the medication needs to travel to the circulatory system. So obviously IV is the correct answer here. Good job, guys. Number 4, when administered to a patient, a metered dose inhaler will A, deliver the same dose each time it is administered, B, be ineffective when given to patients with asthma, C, deliver a different dose each time it's administered, or B, be delivered to the lungs over a period of 6 to 8 hours. Number 4, when administered to a patient, an MDI will A, deliver the same dose each time it's administered. I'm laughing because you guys already got it. Like, I guess I don't have to keep talking. It is A. Very good. You guys are doing a good job tonight. It's absolutely the same dose every single time because it's called a metered dose inhaler. It's already counted out. Very good, guys. Okay, number 5, you are managing a 62-year-old woman who complains of crushing chest pain. Her blood pressure is 84/64 millimeters of mercury, and her heart rate is 110 beats per minute. Megatrol advises you to assist her in taking her prescribed nitroglycerin. After receiving this order, you should A, reassess the patient's heart rate and then assist with the nitro. B, repeat the patient's blood pressure to the physician and confirm the order. C, wait 10 minutes, reassess the blood pressure and then give the nitro. Or D, administer the nitro to the patient and then reassess her blood pressure. Now, I'm going to go back and explain this, whether y'all get this right or not. So if you don't know, put IDK in the chat for me. So I'm going to re-say this again. You're managing a 62-year-old woman who complains of crushing chest pain. Her BP 84/64, heart rate's 110. Med control says give her the nitro. After receiving this order, you should what? A, reassess the patient's heart rate and then assist with the nitro. B, repeat the patient's blood pressure to the physician and confirm the order. C, wait 10 minutes, reassess blood pressure and then give nitro. D, administer the nitroglycerin to the patient and then reassess her blood pressure. Okay. Who in here doesn't know? Put that in the chat. There's only 1, 2, 3, 4, 5, 6, 7 of y'all answering out of 16 people. And I'll say 15 because I'm one of the 16. So if you don't know, put I don't know. That's fine. All right, guys. All right, let's go to the next one. This is something that I forgot to actually put, so I apologize. Really glad that this was done here. So it is B is the correct answer. All right. Why? Nitro is a vasodilator and lowers blood pressure. And it shouldn't be given to anyone with a BP of less than 100. I'm not even entirely sure how I missed not saying that to you guys, so I apologize. So when you go into a patient's house or room or wherever the heck they are, and their blood pressure is under 100, and you have a doctor online, literally on the phone telling you, go ahead and give her the nitro, you're going to repeat that blood pressure and say, are you sure you want me to give this patient nitroglycerin? Because you know what? Did you know that doctors are also human? Yeah. Did you know that humans make mistakes? Yeah. So we repeat those so that they can catch on and be like, Doc, I think our blood pressure is a little too low. It's at this. Did you don't actually say that. They get really angry when you do that. And I guess it's because it seems like we're undermining them. So we don't want to do that part, but we do want to make sure that they heard those numbers correctly because doctors now are in the ER and they're all over the place, right? So we want to make sure that they heard those numbers correctly. So we go back and say, no, Doc, it's 84/64 is her initial blood pressure. Would you rather me recheck the blood pressure first before administering the nitro to see if it goes up? And they'll usually say, oh, yeah. Thanks for catching that for me. Because we work together in healthcare, right? Okay. And so we want to make sure of that. We want to reconfirm that order too. Okay. So, and I've already given you the rationale. I hope that helped everybody. And if it didn't, let me know in the comments and I'll go back and talk about that. I will say D was answered a couple of different times in here. But here's the deal. Just because a doctor tells you to do it, if you know for a fact it's going to be harmful for your patient, you can, in fact, repeat that as many times as it takes for the doctor to understand that that's going to be harmful for the patient. We're the ones that are out in the field, not them, right? Okay, number 6. Activated charcoal is indicated for patients who have ingested certain drugs and toxins because it A, acts as a direct reversal agent for most medications, B, induces vomiting before the chemical can be digested, C, detoxifies the drug before it can cause harm to the patient, or D, binds to chemicals in the stomach and delays absorption. Number 6, activated charcoal is indicated for patients who have ingested certain drugs and toxins because it A, acts as a direct reversal agent for most medications, B, induces vomiting before the chemical can be digested, C, detoxifies the drug before it can cause harm to the patient, or D, binds to chemicals in the stomach and delays absorption. Okay. Debbie, you still need to know what activated charcoal does because even if it's not in your protocol, it will be on National Registry. Okay. Miss Givens, I appreciate you saying that you do not know. That's fine. I didn't tell you what it does. We went over it and I forgot to say. It's D. The charcoal is an absorbent. It's also it binds around these chemicals, and what it does is it delays digestion and absorption by the chemical of that chemical by the body. As a matter of fact, this will help you guys remember this forever. Okay, I had a patient that had ingested I don't know what materials. He had been picked up by ambulance. They had given him the activated charcoal. He went to the ER. He then proceeded to leave the ER because he said, and I quote, "I feel better." And that's when we got the call to go pick him up hours later. And he had defecated all over himself. And when he defecated activated charcoal. Why? Because it literally binded around all the chemicals in his body and it moved it through the GI tract, and that's what came out. And it did not smell nice in the back of the truck, but that's neither here nor there. But if that helps you remember what activated charcoal does, is it is an absorbent. It binds to harmful chemicals. There's only a few of them that it doesn't. Like it's contraindicated to give activated charcoal to anyone who has ingested an acid or an alkaline base anything or like gasoline. And one of the reasons for that is because activated charcoal, when ingested, can in fact make a patient nauseated and vomit. And we don't want someone that has ingested an acid, alkaline, or gasoline to vomit. Number one, obviously, we don't want them to aspirate. But number two, and probably more importantly, when those three types of chemicals come back up through the esophagus, it's going to cause even more burns, more problems, and then we're going to have a potential airway problem. Okay. Number 7, with regard to pharmacology, the term action refers to the A, ability of a drug to cause harm, B, ability of a drug to produce side effects, C, amount of time it will take the drug to work, D, expected effect of a drug on the patient's body. Number 7, with regard to pharmacology, the term action refers to A, the ability of a drug to cause harm, B, ability of a drug to produce side effects, C, amount of time it will take the drug to work, or D, expected effect of a drug on the patient's body. There's only 4 of you answering, still with 16 people here, so I will wait. One, 2, 3, 4, 5, 6, 7. And actually, Debbie answered twice. Debbie, if you'll just answer one time, that would be great. That way I don't have to add you up twice. Okay, so it's going to be, let's see. All right. 1, 2, 3, 4, 5, 6, 7, 8. There's 8 of you. Okay. Now, y'all do know that I do take notes on who is answering and who is not. And if you're at work and you're listening, that's one thing, but there's a continual amount of y'all that are not interacting. And therefore, when I go and I look at how y'all are doing on your exams, that is a direct reflection of the fact that you are not doing these reviews and I'm going to let that sit right where it's at. Okay. So if you want to understand the material better and understand that I am watching, I'm taking notes, I go back through this and I look to make sure you guys are answering these questions. And those of you who are not, I've already noted who you are. I would appreciate it if you guys would get back on here and start answering questions. All right, and the correct answer is D. A lot of you guys said, a few of you said C, a lot of you said D. It applies as action to the effect of the drug is expected to have on the patient's body. Debbie, it has nothing to do with the patient's weight. Prior to administering any drug, the EMT must be aware of its actions on the body. You could be 500 pounds or 50 pounds. The dosage will change, but the action will not. Okay, so I don't want you to be confused on what action means or why. But let's go through our rationale real quick. So the ability of the drug to cause harm is a contraindication. The ability of it to produce a side effect is any action of a medication other than the desired ones. Remember, we have the unwanted and untoward, okay? Or unintended and untoward. C is the amount of time it will take the drug to work, and this is the onset of action, okay? Onset of action, whereas the correct answer is the effect that it will have on the patient's body. Number 8, which of the following patients is the best candidate for oral glucose? A, conscious patient who is showing signs of hypoglycemia. B, unconscious diabetic patient with documented low blood sugar. C, conscious diabetic patient suspected of being hyperglycemic. Or D, semi-conscious patient with signs and symptoms of low blood sugar. Which of the following patients is the best candidate for oral glucose? A, conscious patient who is showing signs of hypoglycemia. B, unconscious diabetic patient with a documented low blood sugar. C, conscious diabetic patient suspected of being hyperglycemic. Or D, semi-conscious patient with signs and symptoms of low blood sugar. Oh no, I'm so sorry, Sydney. Are you back? Yeah, I mean, I'm assuming you're back in since you're in the chat. Let's see, A. Got a whole bunch of A's here. That's good. 1, 2, 3, 4, 5, 6, 7, 8. Somebody has some experience with this one, huh? Okay. The answer is A. Very good, guys. This is given to a diabetic patient with the suspected and documented hypoglycemia or low blood sugar. It should never be given to an unconscious patient because they can't swallow, they can't protect their airway, right? Then that can cause aspiration to the lungs, and then we are really in trouble, right? So an unconscious diabetic, obviously, they're unconscious, can't protect their airway. They're conscious, but they're hyperglycemic. High blood glucose would not be good. No, you would not necessarily have to have a documented low blood sugar first. If you have suspected low blood sugar, you may give them oral glucose as long as they can protect their airway and swallow. Very good question, Tammy. Semi-conscious patient with signs and symptoms of low blood sugar, they're semi-conscious. They still can't answer. So, but an unconscious patient is never the answer for oral glucose. Never put anything in the mouth of an unconscious patient when it comes to something that they are supposed to ingest in any shape, form, or fashion, because they can have that aspiration issue. All right. Number 9, epinephrine is given to patients with anaphylactic shock because of its effects of A, bronchodilation and vasodilation, B, bronchodilation and vasoconstriction, C, vasodilation and bronchoconstriction, or D, bronchoconstriction and vasoconstriction. I've seen a certain person I know have blood sugars as low as 32, so I know a lot about that part. Yep, There's a lot of people that walk around that way. Okay, so let's reread this one. Epinephrine is given to patients with anaphylactic shock because of its effects of bronchodilation and vasodilation, bronchodilation and vasoconstriction, vasodilation and bronchoconstriction, or bronchoconstriction and vasoconstriction. And I'm getting a ton of B's, okay? And the correct answer is B. Very good. So there are two major complications that you have in your anaphylactic shock, one of which is, of course, your bronchoconstriction. They can't move air in and out, right? So epi is going to cause bronchodilation, and of course, we already understand that in anaphylactic shock, they also has vasodilation, widespread vasodilation, as a matter of fact, and it's crazy. It'll drop their blood pressure out of nowhere. So they can't breathe, they can't really move a whole lot because they're have widespread vasodilation. So what does this do? Epi, it causes vasoconstriction. So very, very good, guys. Very good. Number 10, last one. The process by which medications travel through body tissues until they reach the bloodstream is called adsorption, onset of action, absorption, or transformation. The process by which medications travel through body tissues until they reach the bloodstream is called adsorption, onset of action, absorption, or transformation. Getting a lot of C's. All right, that is the correct answer. It's the definition. So here's the example is activated charcoal delays absorption of certain chemicals in the bloodstream because it adsorbs or it bonds to them in the stomach. So very, very good, guys. All right, so we are going to stop recording and